Hello everyone, my name is Sherry with Riverside Heart Savers. Many of you at Parks and Recs have taken our American Heart Association CPR, AED, and First Aid course. My team and I are here today to review the most important parts of the course. We hope that you'll use it as a refresher between certifications. Now in 30 minutes we can't review everything, so we encourage you to continue to look over the workbooks that have been provided in your class. Let's get to it.
My name is Kaulana. I'm here with Riverside Heart Savers. Even in an emergency, your own personal safety needs to be your primary concerns. In the subject of scene safety, we talk about all of the different measures you need to take before and during a response so that you can continue to be safe and effective as a responder. These concerns can be setting specific, down power lines, active traffic, but there are also universal precautions that we need to take into account with every patient, such as limiting our exposure to bodily fluids through the use of personal protective equipment. Once you've ensured that there are no imminent dangers to yourself and donned the correct personal protective equipment, you will be ready to proceed.
Once you've determined that the scene is safe, you're going to want to determine if the person is truly unresponsive. You're going to shout and shake, "Are you okay? Are you okay?" If there's no response and no movement, the person truly is unresponsive. You're going to want to call for help by saying, "Help, I have a medical emergency." Hopefully someone will come to your aid, and you'll want to designate someone to call 911 and someone to get an AED. If help does not arrive, you'll want to grab your phone and call 911. And if you have the capability, put it on speakerphone so that you can return to helping the person in need. Now that help is on the way, you'll quickly want to check for a pulse and breathing. If neither are present, it's important to start CPR immediately. So let's talk about the proper hand placement and location of chest compressions. Right across the breastline and right down the middle of the sternum is where you're going to want to do your compressions. You're going to want to take the heel of your hand, and you'll find that it fits really nicely in the groove of the sternum. So let's talk about hand placement when performing chest compressions. You're going to take both your hands, and whichever is your dominant hand will go on top. You're going to interlace your fingers over the other hand and kind of pivot your wrist to what's almost at a 90-degree angle. You're going to take the heel of your palm and place it in the groove of the sternum. Some other things that are important are the position of your arms and your body. So you're going to want to keep your arms straight, and if you think about the alignment of your shoulder, elbow, wrist, all the way down, and keeping your hips back behind you and your body also almost at a 90-degree angle, this will allow you to use your body, your shoulders, to help provide the compression, and will also make it so that you're not getting too tired too quickly. So we've talked about hand placement and location on the chest. Let's talk a little bit more about the compressions. What's really important, especially when working on an adult, is to make sure that your compressions go 2 inches deep into the chest. But what's also important is to make sure you're allowing the chest to recoil. So when you're pressing down 2 inches, you want to also release so that you're, again, allowing the chest to recoil and allowing for that blood flow and circulation. Compression should be done at 110 to 120 chest compressions per minute. When giving compressions, you want to give 30 compressions in 2 breaths. When giving breaths, you want to make sure to tilt the head back, pinch the nose, and give 2 breaths, just enough to see the chest rise. When giving 30 compressions and 2 breaths 5 times will be equivalent to 2 minutes worth of CPR. This is a perfect time if you have help or someone else that's able to administer CPR for the 2 of you to switch. And this will ensure that the CPR remains high quality CPR. Performing chest compressions provides oxygenated blood throughout the body. However, an AED has the potential to restore heart rhythm and revive an individual.
Immediate use of an AED is an adult victim's best chance of recovery. Therefore, the priority needs to be made to get the AED and use it as soon as possible.
Adverse cardiac events, particularly in adults, tend to be electrical in nature. In these situations, the use of an automated external defibrillator, or AED, can mean a world of difference. It is imperative that you get the AED to the individual as quickly as possible so that it can analyze and respond if necessary. If you are unsure or unconfident on what to do with the AED, simply apply the pads to the patient and turn it on. The AED will direct you further.
Once you turn the device on, the AED will instruct you to remove all clothing from the victim's chest. Once the chest is exposed, the pad should be placed on the victim's chest as illustrated in the photographs. If the victim has a lot of chest hair, you may have to shave beneath the pad placement so that the pads can very tightly adhere to the skin. The pad should not be placed over any implanted devices such as pacemakers or ports that are usually in this portion of the chest. So in that circumstance, you would want to place the pad directly beside the pacemaker or the port. Oh no, what's going on? Are you okay? Are you okay? I have a medical emergency in here. I need some help, please.
Sure, what's going on?
Can you please call 911 and get the AED near the elevator?
Yes, absolutely. I have 911 on speakerphone right here.
Excellent,
I have
thank you.
an AED.
Perfect. Can you open it up and press the on button?
Adult patient.
I'm just going to
If the
continue
patient is a
CPR.
child, press the child button. Remove clothing from the patient's chest.
I'm just going to work around you here.
Perfect,
Remove
thank you. I'm going to
pressed
continue
pads
CPR.
firmly on skin.
Let me get in here real quick.
Thanks.
Pressed pads firmly on skin. Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear.
Everybody clear?
Press the flashing shock button. Shock delivered. Begin CPR. Ten. 20.
Chest compression should only be stopped when the AED directs you to, like when it is analyzing the heart rhythm or delivering a shock. If you are the one handling the AED, it is your responsibility to shout clear and look up and down the patient, making sure that no one is touching the patient as you administer the shock. As Riverside Parks and Rec staff, you will have access to an AED at your workplace. Familiarize yourself with its location so that you are able to get it when you need it.
While working at Parks and Recs, you may have a situation where an adult is choking and has an obstructed airway. The first thing you want to do is to assess the individual's breathing. If you can hear breath sounds, wheezing, or if the individual is able to talk, we want to monitor closely. If the person is breathing, we want to encourage them to continue to cough and potentially dislodge the obstructing object. Once we no longer hear breath sounds or the patient is unable to vocalize, it is time for us to intervene. To perform abdominal thrusts, you want to get behind the individual. You're going to wrap both of your arms around the individual's abdomen. With your dominant hand, you're going to make a fist and put the thumb side of your fist into the person's soft part of their abdomen between their belly button and their rib cage. With your other hand, you're going to put it over your fisted hand. Now to perform abdominal thrust, you're going to want to squeeze inward and upward like so. Okay. The abdominal thrust movement again should be in and upwards, and you want to do this forcefully several times until the obstructed item gets dislodged. If the person is too tall for you to do abdominal thrusts, you can ask them to sit down on a chair, come up and kneel behind them, and then go ahead and perform the abdominal thrust. If you're unable to do abdominal thrusts because the individual is pregnant or is obese, you want to still continue to do the same thrusting, but at the chest level where we do chest compressions. The goal of abdominal thrust is to dislodge the object. When the abdominal thrusts are ineffective in dislodging the item, the individual will become limp. We want to safely lay them down and at this point transition to chest compressions.